The approach with equity is understanding that there are specific challenges that are more intrinsic to what a community needs to overcome in order to access tools such as vaccines, or to describe why they are more impacted by cases and hospitalizations. When you look at the determinants of health, where someone lives, where they go to work, where they get their quality of food, where they learn and get their education, you can look across the state and recognize that in some zip codes, the quality of those factors are different from other areas. And so that means you may have people that have less access to higher paying jobs, potentially because their educational opportunities were not as ideal, or they didn't have access to the nutritious foods that are necessary to help ensure that your mind can focus on learning or working in an effective role. That would then mean when you have something like COVID come about, you have individuals who have to go out to work, be more exposed, that may not have the type of housing situation that allows for isolating yourself or quarantining effectively if you needed to, or have the type of foods to avoid getting sick or avoid having some of what we call our comorbidities, like diabetes, high blood pressure, obesity, that would increase your risk of being hospitalized if you were to be infected with the COVID, with the coronavirus. So having access to the tools to support it from an equity perspective means we need to pay even more attention in ensuring that those communities have access to testing, have access to vaccination, and the education to support them understanding why it's necessary for you and your families to take advantage of the tools that are available. You know, what you do for yourself and your household actually does matter for the people in your neighborhood, the people you come across in the grocery store that you may worship with or that you may work with. Public health means it's not just about your own family's individual choices, but knowing that those choices can impact the people around you, and making decisions with that understanding can help it so that we can all thrive. If we did not have the high level of vaccination rate that was needed through the time when the Delta strain was increasing, we would have had statewide significantly worse outcomes, and that would impact people's ability to stay in school. That would impact the ability then to be able to go to work, the ability for you to be able to pay your rent or your mortgage and continue to live where you are, or even to be able to get out and access the food that you need to sustain the nutrition and development for your own family. Everything is interconnected. And so the more we can make informed and positive decisions for yourself and for your household, the better off we can thrive as a state.
Do you feel like you're being heard? You know, we saw you on TV a lot. Do you feel like that message is being received by Rhode Islanders?
I do. I'm proud of what Rhode Islanders have embraced and understood with our vaccination rates, leading the nation in testing as well. We can do our part in the Rhode Island Department of Health. Our colleagues have gone above and beyond, day after day, hour after hour, month after month, to ensure that the systems are in place and the tools are available. And then it's up to Rhode Islanders to be able to access them, to be able to get vaccinated, to get tested, to ensure that they're masking appropriately and distancing where they can and making good choices. And so we have done that overall. There's always room for improvement, and it's why we stay committed to messaging every additional person that hears this and makes a better decision for themselves and for their family makes it worth it. And we know that everything we do now is preparing us for the future. There will be, more pandemics. There will be, even in the fall and the winter, a return of cases, even if it's, similar to what we have dealt with during the flu season. And everything we do now prepares us for making sure that that time is something that is tolerable and that we can get through and be successful. We want that for all Rhode Islanders, and we're doing that here at the department. We are constantly looking at ways to strengthen what we do and the message that we are delivering and how we are providing the tools for individuals. And we need all the support and resources here so that we can continue to deliver that for Rhode Islanders.
And you've been called an inspiration, and we've always heard from people how important it is and powerful it is to have not only a woman, but a diverse woman leading the state. Do you believe that makes a difference, and do you see it making a difference other places as well?
Absolutely. I have loved the phrase from one of my mentors that diversity brings strength. And having diverse perspectives, being able to get different takes on what's needed, that strengthens us to have the most effective strategy that we can implement for going forward. And it's an honor for me to know that there are young women, young men, people of color, people of diverse backgrounds who are watching and saying, wow, she's there. That means that's something I can do going forward into the future. And I'm here to certainly cheer them on as well and say absolutely, because every voice and every perspective is needed, it matters, and it will make a difference